All right, let's get right into it. We're going to take a tour of one of your body's hardest working systems, one we honestly don't think about much, that is, until something goes wrong. We're talking about the urinary tract. We'll explore how it all works and, just as important, what happens when the system hits a snag.
So have you ever really thought about it? This system is working non-stop, 24/7, filtering out waste and keeping our body in balance. To make sense of it all, let's use a pretty simple analogy. Just think of it as your body's own internal plumbing system. That idea is going to be our guide as we see how it works, and what happens when you get a clog or a leak.
Okay, so who are the main players here? Our little tour starts with the kidneys. Think of them as these super advanced filter stations. From there, urine travels down to the bladder, which is basically an expandable holding tank. And finally, it all exits through the urethra. Sounds pretty straightforward, right? But let's see what happens when problems pop up at each stop.
So our first stop on this tour has to be the source, right? The kidneys. This is ground zero for urine production, and unfortunately, it's also where some of the most painful and serious issues can kick off.
First up, something I'm sure you've heard of, the dreaded kidney stone. The fancy medical term is renal calculi, and they are exactly what they sound like, these hard, tiny crystals. What's wild is how they can form from really simple stuff, like just not drinking enough water, or maybe having a diet that's a little too high in things like calcium.
Now, if you know anyone who's had a kidney stone, you know the first thing they talk about is the pain. And we're not talking about a little ache. This is a severe, intense, wave-like pain. They call it colicky, right in your side and back. It's the kind of pain that has you running for the ER, no questions asked. But it's not just the pain. Other telltale signs are things like hematuria. That's just a medical way of saying blood in the urine, plus nausea, vomiting, and that awful burning sensation when you try to go. So how do you deal with them? Well, step one is managing that pain. And then the big one. You got to drink a ton of fluids. We're talking 3 to 4 liters a day to try and flush that thing out.
Okay, so sticking with our plumbing theme, what happens if you get a major clog right at the source? Imagine a dam blocking a river and the water just keeps backing up. That's pretty much what hydronephrosis is. The kidney literally swells up like a water balloon because the urine has nowhere to go. It creates this massive pressure backup.
So what's causing these clogs? Well, a lot of the time it's those kidney stones we were just talking about. But it could also be tumors or a narrowing in the pipes called a urethral stricture. For men, a really common culprit is an enlarged prostate, which can literally pinch the tube shut. The solution is just what you'd expect. You have to clear the blockage to relieve the pressure. Sometimes they'll even put in a little tube, a stent, to keep things propped open.
And one last thing to cover in the kidney department is something a little different. It's called polycystic kidney disease, or PKD for short. Now, this isn't a blockage. It's actually a genetic thing where all these cysts start growing inside the kidneys. Over time, they make the kidneys huge and stop them from working right. The big signs are high blood pressure and that flank pain again. Managing it is all about controlling blood pressure, but eventually it can lead to needing dialysis or even a kidney transplant.
Okay, let's move on down the line from the kidneys. Our next stop is the bladder, the holding tank of the whole system. But, what happens when the tank itself starts having problems?
And that brings us to something that a lot of people deal with, urinary incontinence. It's basically the involuntary loss of bladder control. And there are so many reasons this can happen. It could be weakened pelvic floor muscles, maybe after childbirth, or it could be related to nerve issues, or just, a natural part of aging.
What's important to know is that incontinence isn't just one thing. There are different types. For example, you've got stress incontinence. That's when you leak a little when you cough or sneeze. Then there's urge incontinence, which is that I gotta go right now feeling that comes out of nowhere. Overflow is pretty self-explanatory. The bladder's just too full. And functional is when there's a physical reason you can't make it to the bathroom in time. A lot of people actually have a mix of these.
Okay, now for a really tricky one to diagnose, interstitial cystitis. Here's the deal. Imagine you have all the classic symptoms of a nasty bladder infection. The pain, having to go all the time, but when you get tested, there's no infection. That's interstitial cystitis. One of the classic signs is that the pain actually gets a little better right after you, empty your bladder.
It's pretty incredible how your bladder and brain talk to each other through this whole web of nerves.
But what happens if those nerves get damaged, say from a spinal cord injury, a stroke, or even diabetes? Well, you can end up with what's called a neurogenic bladder, and it can go one of two ways. The bladder can get overactive and spastic, or it can become underactive and just can't squeeze properly. This can lead to either leaking or not being able to empty at all. Often, people manage this by using a catheter intermittently.
All right, we're at the last stop on our little tour, the exit pipe, so to speak. The problems we see here are pretty much all about blockages and flow issues, things that stop the bladder from emptying out like it's supposed to.
And that brings us right to urinary retention, which is exactly what it sounds like. You just can't empty your bladder, either all the way or just partially. And again, this can be caused by a few things: an enlarged prostate creating a blockage, bladder stones physically getting in the way, or even as a side effect from some drugs.
But here's the thing. Retention can show up in two very different ways. You've got acute retention, which comes on suddenly, is super painful, and is 100% a medical emergency. Then there's chronic retention. This one sneaks up on you over time. It's usually not painful, so people might not even know they're not emptying their bladder completely.
Another thing that can mess with the flow is a urethral stricture. Think of it like a kink in a garden hose. It's a narrowing of the urethra, usually from scar tissue left over from some kind of trauma, an infection, or even from having a catheter in the past. The number one sign? A really weak stream.
So how do you fix a kink in the pipe? Well, you have to physically open it back up. The first step might be just stretching it out. That's called dilation. If that doesn't work, they might go in and make a tiny cut to release the scar tissue, and urethrotomy. And for the really tough cases, surgery might be needed to reconstruct that part of the urethra.
Okay, so we've toured all the things that can go wrong. Now for the important part. How do we keep the whole system running smoothly? Let's finish up by talking about some key strategies that can really help with a lot of these issues.
When it comes to managing these problems, especially something like incontinence, being proactive is a game changer. We're talking about things you can do. Like Kegel exercises, they really work to strengthen those pelvic floor muscles. There's also bladder training, which is about teaching your bladder to hold more urine for longer. And even just scheduled voiding, literally going to the bathroom on a schedule, can help prevent accidents.
And you know, so much of this boils down to simple daily habits. We already talked about drinking enough water. That's probably the single best thing you can do to prevent kidney stones. Or think about diet. If you have interstitial cystitis, avoiding things that can irritate the bladder, like spicy foods, can make a real difference. And don't forget stress. It can make almost all of these conditions worse, so finding ways to manage it is a huge help.
And that's our tour. We've journeyed through this amazing, complex plumbing system, and we've seen what can happen when things get clogged or start to leak. So I'll just leave you with this one question to chew on. What's one small thing you could do, starting today, to support your own urinary health? Thanks so much for joining me.